different types of heart rhythm problems that can cause patients to feel an irregular heartbeat. But the most common type is atrial fibrillation. AF causes the heart to beat irregularly, and when the heart is beating irregularly, it causes abnormal circulation of the blood. When the blood doesn't circulate normally, it increases the chance of forming clots inside the heart. So the theory is that when these clots, which are usually very small pieces of solidified blood, if these clots break off and travel into the brain, for example, it could block the blood vessels in the brain and result in a stroke. Typical symptoms would include palpitations, chest discomfort, or patients may feel breathless, dizziness. Some may even end up having fainting episodes. We have a range of treatment options available. First thing we will always try would be medication, and there are also, depending on the patient's condition, of course, there are also other options such as a pacemaker implantation, if appropriate, and also in some patients who may be not suitable for medication or who have tried medication but didn't find it helpful, then we may also consider an ablation procedure. So an ablation procedure is a minimally invasive procedure that is carried out to treat patients with arrhythmia. And in many cases, AF patients are also suitable to have this procedure. These days, we also have technologies available to us to help improve our effectiveness when we are carrying out AF ablation. So for example, we have 3D mapping systems which allow us to visualize the heart in a 3D space to try and target and focus on where these abnormal electrical signals are coming from. And in the last few years, we have also seen the arrival of new energy sources in the form of pulsed field ablation technology, where it allows us to carry out ablation using a different type of energy source. And the benefit is that it is able to do this with greater precision and also with greater efficiency. AF is a complex disease, so when we are treating AF, we are not just treating the heart rhythm problem alone. It often comes together with other medical conditions that increases the patient's risk of getting atrial fibrillation. So, which is why in this kind of situation, one doctor alone or one person alone may not be enough. So that's why we need to involve a team-based approach where we can call upon our other medical doctors or cardiologists to assist. And also very importantly, we have arrhythmia nurses, we have dietitian input, and also physiotherapy input, because all these things are important in the treatment of AF and its risk factors. Rehab is important because quite often when patients develop a medical problem, they may lose confidence, they may be worried about what kind of exercises or physical activities they can carry out. However, even if the patient is well after that, the treatment or the journey doesn't just stop there. We have to continue to follow up these patients over a long period of time to make sure that their risk factors are properly managed, which is where an AF clinic can come in and benefit these patients.